Good morning, everybody. Welcome to our May webinar. I am Dr. Lloyd Parks. I am the Leadership Development and Institutional Strengthening Specialist with the Caribbean Center for Development Administration, CARICAD, as part of our strategy to promote ongoing learning and development for our stakeholders. We host a number of webinars throughout the year, usually monthly. And this month, we are looking at a very, very important topic to all of us, a topic that is really near and dear to my own heart, which is the aging Caribbean population and the implications for public policy. And we have as our guest, Ms. Sandra Latibeaudiere, who I will introduce later in a more fulsome way. But for those of you who might be new, maybe this is your first time attending a CARICAD webinar, a special welcome to you. And if you are attending a CARICAD webinar for the very first time, I would be so grateful if you would just share that with us in the chat. And so to ensure that this is a really impactful and beneficial virtual learning session for you, we have a number of ground rules. Now, distractions can be your enemies in this case. So you want to close all your various software applications on your device that you're using to join, except for Zoom, of course, and to mute your phones, whether it's your cell phone, your office phone. If you're joining from your office and you can't mute your office phone, you can see if you could turn the ringer down. And your colleagues, you want to remind them, this is your time for your own learning and development. And typically, no one will die for the next hour if they allow you that space. Now, we still sometimes have bandwidth issues. So if you have an internet cable, we encourage you to use that. For webinars, you don't necessarily have to use your microphone. But if you want to speak, you want to make sure that your microphone is working. All right. But certainly, using the chat to communicate, to give your comments, ask your questions, that's definitely acceptable. And we will be monitoring the chat feature for all of your comments and for your questions as we go along. And so Rihanna Patterson, who is the founder of Dominica Dementia Foundation. Rihanna is our first time here with us. Rihanna, a very special welcome to you. And thanks for the work that you're doing through the Dominica Dementia Foundation. And in fact, it is through a similar organization here in Jamaica that I actually made a connection with our guest facilitator today. And you guys are doing some very, very important work. And, when the time comes for discussion, Rihanna, feel free to jump in on this, because this is one of the special angles we're going to be looking at this issue from. All right. So lots of people are jumping into the chat and telling me good morning. Good morning to us. Right. And so we always like to know, where are you joining us from today? So Cheryl, say good morning. And Cheryl is my friend from long time. She's my Trini sister. Welcome, Cheryl. And I see from the chat, I am seeing persons. I'm seeing, welcome to my colleague, Franklin Michael. He is based in Barbados, but Frank is really a CARICOM man. That is Frankie's nationality. I want to welcome especially Permanent Secretary Soyinka Grogan from Guyana, Department of Public Administration. Jeffrey Ford, where he's not connected quite yet, he's logging in. From RSS, I see Larry from Anguilla. I'm seeing a lot of names that I know. Mary, welcome, Mary. Some people are, Karina from Grenada. So if you just type in the chat, where are you joining us from today? I am joining from Kingston, Jamaica. So when I give you a chance to put in the chat where you're joining us from today. And here's the other question that I have. What is it about this topic that you find fascinating? Jeffrey from RSS. Hi, Jeffrey. Jeffrey is also one of our alumni from our leadership development programs. I see Jacqueline Bailey William joining from BVI. Yes. Cleveland Emmanuel joining from St. Lucia. Yes, I was recently in St. Lucia, and man, for their Jazz and Arts Festival, it was off the chains. Isaac, also one of our leadership development program alumni, joining us from New York, although he is really from Grenada. Welcome. Carlton Faranguilla, yes. Carissa Hackett from Trinidad and Tobago. Kimberly Hines Herons from Jamaica. Catherine Jones Douglas from Trinidad. Rihanna is tuning in from England. Okay. So really, I should say good afternoon to you. Yes. Clancy also joining us from the UK. Special welcome to you all. Eileen is joining from the Virgin Islands. Sandra Martindale from Barbados. Simone Lexom Nibs from BVI. Yes. Ruth from Trinidad. Mary from St. Lucia. And Mary, no, I have to say a special big up, because Mary is now telling me that she in the chat that she's now been promoted to the level of permanent secretary. Now Mary did our customized senior leadership program for the government of St. Lucia. Mary, congratulations, big up. Robertine from Antigua and Barbuda. Onika from Trinidad. Yes, Janice also from Trinidad. And so Rihanna is telling her master thesis is on dementia policy in the Caribbean. So this is very interesting to her. Great. And, you know, as we talk about this topic and what is it about this topic that fascinates us? So Isaac says he's getting quote unquote old. Well, aren't we all? Aren't we all, Isaac? And so interested in this topic because it's critical for policy and for planning. Michelle is interested in getting different perspectives on the implications for public officers. So Sonia Evans is joining from Ministry of Tourism, Jamaica. And she's a policy analyst, and she believes that information is pertinent. Sandra Martindale is in the process of doing research for a nonprofit that she wants to set up. I'm assuming related to this area. So, you know, this is information gathering for you. You know, fantastic. And so I'm continue to share in the chat. And if you want to even raise your hand to share, you can let me know. Just raise your hand and we can help you to unmute. Share. Now, for me, why do I find this topic so fascinating? And I find it fascinating because, like Isaac, you know, I certainly recognize that I am getting older. I was happy to reach a grand age of 50 on my last birthday. And it was also the experience of elder care and caring specifically for my father until his passing in 2021. And going through that journey, I remember sharing a lot with a mutual friend of mine and Sandra, who is a guest presenter today, who is also involved in working with persons and families living with Alzheimer's and dementia. And that's how I met the guest facilitator. And also I like to think of myself as a student of public policy. And so I started to think about what does this mean, you know, for all of us really. So personally, you know, as I experienced it, it had to do with, the financial implications of dealing with elder care and how do we plan for it personally and also nationally. It was also about what it meant for us as a community. And the truth of the matter is, the same way it takes a village to raise a child, I found out it takes a village to take care of the elderly. And what is the quality of that village? What resources does that village need? And so when we think about community and the fact that our family structures are very different. So I was the only of my siblings living in Jamaica. And what, the implications of that for the elder care. Also, the implications in terms of gender roles that tends to emerge when elder care comes about. I have to think about my own self and how am I planning for my own care and upkeep. Should I be so fortunate to become elderly? I started to think about what does it mean, kind of led to this webinar. What does it mean from a public policy perspective? We are not good. The records are there to show that not only the population aging, and as I talk about the population aging, I want to acknowledge the head of the statistics office of the government of Montserrat, one of our alumni, Siobhan Tweet. And so Siobhan, I would encourage you in the discussion feature to dip into the discussion from the perspective of the statistics that you're seeing, not only in Montserrat and in the region, that you could shed some light on this all-important topic. It's not only about pension planning, it's about, public health implications, to think about what are the services that we have for specifically the elderly, the aging population. What should those services look like? What do they need to look like? What is the scope of public-private partnerships? And so going back to my chat, and so Kaylin is saying, here, checking off the same points as you are. Parents, environment, me getting older, yes. Karina says, I could identify as I have aging parents and lost my father last year after a period of a few months caring for him. My condolences, Karina. I know what that is like. Kaylin says, yes, the gender roles. And she has one sibling who is a male. I mean, it's amazing to me how, the gender role of elder care is alive and well. I can remember a friend of mine, a woman, mark you, who has 2 sons. And I remember her saying to me, she started to pray from now about her sons' wives and the quality of those wives, because when you're old, you can't depend on the son. It has to be their wives. And should that really be so? So Faye, welcome Faye. Faye is another one of our esteemed alumni from our leadership development program. And so Faye is from Barbados, and Faye says, in Barbados, we have an aging population. Oh, yes. In Barbados, I think, and of all the Caribbean countries, probably has the fastest growing aging population, and the birth rate is the lowest. So the implications of that. All right, so let me tell you a little bit about CARICAD before I bring on our guest. So for those of you who are new to our webinar, who are we at CARICAD? We are an arm of CARICOM. We have been in existence over 40 years, and our aim is to support member states in the area of public sector transformation. And we do that through a number of technical assistance initiatives, as well as capacity building initiatives around these areas you see listed here on the slide, including strategic planning, leadership development, change management, business process analysis, capacity building, business continuity planning, human resource management and development, organizational design and development, among others. And so our work is governed by the Charter for the Public Services, which is a common conceptual framework for public sector transformation. I won't necessarily get into the details of this charter, but if you wish to learn more, all of this information is available via our website, www.caricad.net. So, to introduce our very beautiful, very lovely, very learned facilitator today, Miss Sandra Latibeaudiere, is a mother of a young adult son. Give me a second here. Sorry. She is a social worker by professional advocate and academic. And she has over 18 years experience teaching in the social work program at the University of the West Indies, the Mona campus. And so she has extensive experience in the fields of aging, dementia care, disability, gender, and community development. And her passion for these topics go beyond the academic. And she is a board member for Alzheimer's Jamaica. And she recently co-founded the Dementia Care Network of Jamaica, furthering her commitment to improving the lives of those affected by dementia. And so she is now pursuing her MPhil stroke PhD in aging studies at the medical science faculty. And so she is really drawing on our extensive wealth of knowledge to help us to begin to address this topic of the aging Caribbean population and the implications for public policy. And so I'm going to allow her to, bring up her screen now. And just to tell you, this topic is the classic wicked public policy problem. Okay? So we're not going to cover everything today. Okay? And we could literally have an entire series on this from all the multiple dimensions. And so I'm going to hand over now to Sandra. And at the end of her presentation, we'll have an opportunity for questions and discussion. So Sandra, welcome again. Thanks for taking the invitation, and over to you.
Thank you so much, Dr. Parks. I am so excited to share with you this morning. And as Dr. Parks mentioned, we could take it from many, many angles, but please bear with me. Just let me go through my focus and then we can talk at the end. So let me start formally. Good morning and thank you all for joining this webinar today. Thank you, Dr. Parks and your colleagues for planning this session about a topic that is becoming increasingly relevant in our Caribbean society, our aging population. I'm delighted and privileged to share my thoughts and documented research in this area. The phenomenon of an aging population is not just a demographic trend, it's a profound shift that has far-reaching implications for every aspect of our lives, from healthcare and economics to social structures and public policy. So, as we navigate this presentation, we will explore the demographic trends, why population aging matters, dementia, a critical area of focus, planning for aging population, and please bear with me, I'm using Jamaica as a case study. So I'm operating from Jamaica. So Jamaica will be my case study, planning for aging population, and I will end with question and answers. So come with me on this journey as we explore how we can respond to the needs of the Caribbean's older population with compassion, innovation, good practices, and proactive policymaking. So I start with this quote, and it has been, since the beginning of recorded human history, young children have outnumbered older people. This will soon change. I think when this quote was first enacted, it will soon change. Actually, it has started to change. And so for the first time in history, people aged 65 and over will outnumber children under age 5. So population aging around the world are graying. So population around the world, as I said, are aging. So we have what is called a graying population. It is projected that by 2030, which is less than 6 years from now, the world population is likely to have 1 billion older people, accounting for 13% of the total population. Interestingly, the number of people aged 80 years or over is projected to triple from 143 million in 2019 to 426 million in 2050. So if you notice, the persons aged 80 and over is growing at a faster rate than the other older persons. So this is a chart that I found about the population trends between 2015 and 2050. And you will notice that some of them, the projections, is for some of them to fall. So for example, North America and Oceania, in 2015, it was said to have 9.5% of those over 65. It's projected that for 2050, this amount will fall to 6.6. And for Africa is expected to increase from 6.6 in 2015. It's projected that it will increase to 9.6% in 2050. Latin America and the Caribbean in 2015, 7.6%, and it's projected in 2050 to be 8.9%. So for Europe, 21% in 2015, and in 2050, it is projected to 12.6%, so as a reduction. Asia, 55.3% in 2015, and is projected in 2050 to be 62.3%. So these are some countries with percentage of population aged 80 and over projected to quadruple between 2010 and 2050. In Asia, some countries like Mongolia, Singapore, South Korea, Thailand, and the others. For Europe, Bosnia and Herzegovina. For Latin America and the Caribbean, Brazil, Colombia, Costa Rica, Cuba, Nicaragua, Trinidad and Tobago. And for North America, Oceania, Papua New Guinea. And so in the Caribbean, the largest share of all the adults within the Latin America and the Caribbean currently resides within the Caribbean sub-region. So I heard somebody talked about Barbados. So it is noted by CEPAL that Barbados and Cuba are at the very advanced stage of demographic transition and among the forerunners of population aging in the Latin America and the Caribbean region. So most countries within the Caribbean sub-region can be classified as being at an advanced stage of demographic transition, with the exception of Belize, Guyana, Jamaica, and Suriname, where aging is not so advanced. But overall, all the populations are experiencing an increase in older people. So these are some of the countries that it is projected based on the United Nations Department of Economic and Social Affairs and the World Population Prospects to change in for 2050. So Anguilla, Antigua and Barbuda, Barbados, Belize, Turks and Caicos expected to double by 2050. Dominica is expected to triple by 2050. And St. Kitts and Nevis expected to quadruple by 2050. And the report also stated that countries like Anguilla, Antigua and Barbuda, Barbados, Cuba, and St. Kitts and Nevis, Turks and Caicos, Trinidad and Tobago, and St. Vincent, the oldest population, which is those over 80, will be greater than those in the 55 to 79 age group. So what I want to say, just quickly, in 1982, when the first World Assembly on Aging was held in Vienna, world leaders acknowledged the significant changes occurring in populations of older people. The increasing numbers of older individuals were already having an impact not only on developed world, but also in less developed countries. So this is 1982. Many of us on this chat may have been teenagers, so it didn't mean anything at all to us. Similarly, in 1999, which was declared the UN Year of older adults, I still didn't grasp the full understanding of what this meant. That declining birth rates and death rates, shifts in the population age structure equated to an aging population. Again, that still did. I was about in my about 30s, so I still, that didn't mean anything to me. And I think some of you can resonate with that. But implicit in global aging is a success story. It represents a triumph of medical, social, and economic advances over diseases, but it also represents tremendous challenges. And as I said earlier, population aging strains social insurance and pension systems and challenges existing models of social support from childcare and schooling to housing and transportation, from hospital care to long-term care, from the workplace to community services. It affects economic growth, trade, migration. I want you to take note, disease patterns and prevalence, and the fundamental assumptions about growing older. So I want you to keep this at the forefront. Declining birth rates and death rates, a shift in the population age structure equates to aging population. So in other words, so let us break it down. People age 65 and over are outnumbering children under 5 years. In some countries, we have people who are retired at 60. So we have an aging population. Older people are more than the children under age 5. Life expectancy is increasing. Most countries, including developing countries, show a steady increase in longevity over time, which raises some questions. How much further will life expectancy increase to? Are we going to have people living to 100, 110, 120? What are the implications for that? Are we living healthier and longer lives? Or are our additional lives spent in poor health? So these are questions that we have to contemplate as well. The number of the oldest old is increasing. So people over age 85 are among the fastest growing population in any nation. So taking those three together, what are the consequences of that? There's an increase in the dependency rates. That is a ratio of older people to younger people. There's a decrease in the participation rates. That is the number of people in the workforce. So I want you to think about that while we add other things. Then we have the increase in non-communicable diseases, which are becoming a growing burden. Chronic non-communicable diseases are now the major cause of death among older people in more developed and less developed countries. And I said I was using Jamaica as my case study. In 2019, the Mona Aging and Wellness Center at the University of the West Indies, with funding from the Pan American Health Organization and the World Health Organization, carried out a study and found that the major non-communicable diseases in the population 60 and over were hypertension and diabetes, 2 leading, and the others that follow, arthritis, cancer, stroke, asthma, and heart conditions. And studies have said that in the next 10 to 15 years, the loss of health and life in every region of the world, including Africa, will be greater among non-communicable or chronic diseases, such as heart disease, cancer, and diabetes. Something to think about. And based on slide 5, you would have seen that some population will shrink in the next few decades. So while world population is aging at an unprecedented rate, the total population in some countries is simultaneously declining. We saw that among the North America, Oceania, and Europe. Another thing that we have to think about in population aging, family structures, as we said, are changing. So people are living longer and having less children. So as people live longer and have fewer children, the family structures are going to be transformed, leaving older people with fewer options for care. I hope you're seeing the implication for policies. And I want to flag here that childlessness is another important factor that we will have to consider. That is not on anybody's agenda right now, but we need to take note that many women now are not giving birth. Many women have decided that they will not have children. So studies have told us that in modern society, about 20% of women will not give birth. So they will not have children. Then we want to take into account the patterns of work and retirement, and these are shifting. And I'm going to spend a little time on this because it has implications for income security like pensions. It has implications for many things. So indulge me a bit. So because we have shrinking ratios of workers to pensioners, and people are spending a larger portion of their lives in retirement, increasingly straining existing health and pension schemes. Again, from Jamaica, data from the Survey of Living Conditions. And for those who do not know, Survey of Living Conditions is carried out every year. It is at the household level. And in 2012, which is a study that I'm using, although a bit dated, in 2012, the study did a separate reporting on the aging population, and it found some interesting thing. And I think even today, even though it was done in 2012, it still has implications, even for Jamaica now. The study found that the main source of income for the elderly was local family support, and that accounted for 22%. Being employed and self-employed accounted for 20.9%, and receiving a pension 19.9%. The results of the study reflect that the majority of older adults do not have health insurance, as many work in the informal sector. And so again, another policy flag, or the workers in the informal sector. Those who do not have a health insurance or are living on a pension, the pension at that time in the study amounted to less than $10,000 per month, which is about $64 US. Based again, not a policy implication, based on the work that people are doing. So we have a lot of people in low income jobs who are retiring without a pension, and they are retiring even poorer than when they started. So at least when they were younger, they could hustle and do a little bit of, we have quite a bit of persons in Jamaica, and I suspect in other countries, beg a little here and there. And so there are policy implications for that. So as our social insurance evolves, because people are living longer, and the pensions are not covering as long as it had planned, because many years ago, when we started our pension, we assumed that people live about 5 years after they retire. This is not the case. Because we're living longer, it has implication now for our existing pension scheme. So in April 23, the Jamaican government approved an act to amend the national insurance to increase contribution paid. So people are now paying a little bit more for their NIS, the national insurance scheme, and they increase also the benefits under the act. Again, because we noted that people are living much longer, 10, 15, 20 years after retirement, which was not the case in earlier years. So now, as we take note, we are noticing that there are new economic trends that are emerging. Population aging will now have an effect on our social entitlement programs. It will have an effect on our labor supply. It will have an effect on trade and savings around the globe. And it will demand new fiscal approaches to accommodate this change that we're seeing in our societies, in our aging societies. And so we're looking at it now at the national level, but population aging also operates at an individual level. So for all of us, as we age, there are certain changes that will take place. We will have physiological changes. We'll be a little bit more frailer. We may not hear so well. We may go up a little slower. So these are the individual level that we also have to take into account. At individual levels, the frail, as I said before, we have a little aches and pains there and then. But we also have cognitive changes, which is what I want to spend just a little time with you. So our cognitive health is going to be an important factor. And there are age-related changes that occur as we age. And though not a natural part of aging, dementia is a risk as we get older. And chronic, non-communicable diseases is also a factor that we'll talk a little bit more about. So if you take care of your heart, you're also taking care of your brain. So whatever you do for your heart is also impacted on your brain. So heart health is also brain health. So let's talk a little bit about this thing called dementia. So dementia is not a single disease. It's a collection of signs and symptoms. So it affects your brain. So there are going to be many different things happening with the person that has this disease. It's going to affect your ability to remember things, to use language, to complete a full sentence. It's going to affect your perception and your attention. It's going to affect your behavior, your mood, and your personality. And as the disease progresses, it will affect your ability to function, to perform activities that, as we call, activities of daily living, taking care of your personal hygiene. How we come to dementia? We come to dementia at different, it's caused by different things, and we come by it from at different spaces. So for Alzheimer's, that many of us know, it's an accumulation of abnormal proteins that are on the brain. For vascular dementia, that comes from blood vessels and supply of oxygen to the brain. So the brain is starved of oxygen, as in when somebody has a stroke, it can lead to dementia, vascular dementia. So the progression of the disease, it's a chronic condition, and how we come to it, the different patterns of onset and progression. As I said before, with dementia, of the Alzheimer's type, it's progressive. So it's longer. takes a longer time. People can live with it for up to 10, 20 years without being diagnosed. They can be in the mild stages for a long time. Yeah. And so we come to that different stages. But with vascular dementia, it will happen even overnight. Somebody can go to bed, have a stroke, and when they wake up, they don't remember who they are. So the average duration of care needed, average, is 8 years. So again, a policy implication that we have to think about. So when we talk about the syndromes of dementia, and because we say it's a disease of the brain, it affects many quadrants and many behavioral things that people will display. So we talked about the cognition, so it affects your memory, your judgment, your attention, your executive functions, such as your ability to focus, your ability to self-regulate, your ability to organize and to plan, and so on. So it affects that. It also affects your visuospatial, how you measure distance. So for some persons who have like dementia with Lewy body, they will be in a space and they will look at a tile, depending on how if the tile has any reflections on it, they will look at the tile and they will see like snakes and other things happening. And so a person with dementia can fall because of their visuospatial. They're not able to understand distance, and they're seeing, some of the tiles. Even when they look in the mirror, they may see a stranger. They're looking at themselves, but they may see a stranger. It also affects the person's language. So person, as I said before, will affect their ability to hold a complete, to speak a complete sentence or to talk coherently. Then there is a neuropsychiatric piece. So there are persons with dementia who will first display with depression. And this happens because when persons have mild cognitive impairment, they tend to repeat themselves. So they ask the same things over and over and over. And so people get very impatient with them. And because they don't want people to get impatient with them and they want to hide the fact that they're not remembering, they tend to self-isolate. And so they will develop depression because they don't engage with people. They don't want to speak because people are always saying to them, family members and friends will say to them, "You've asked me that already. Stop asking me the same thing." And so again, another of the neuropsychiatric, the psychosis, the hallucinations, seeing and hearing things that are not there. Persons with dementia also are apathetic. They're neither happy nor sad. They don't know, their emotions are neither happy nor sad. They have what is called a blank affect. Some of them will be agitated, and agitation can come from the fact that they are not able to tell you what they are feeling. So sometimes if they're wearing diapers, they may be wet. And so they can't explain to you that they're feeling uncomfortable. And so it presents as agitation. And for some persons, they call it confrontation, oppositional. These people are so hard to work with and they're so disgusting. But really and truly, it is something that is affecting them. That is a person with dementia that I'm talking about. And they're unable to tell you. And so it appears as agitation or oppositional, and being defiant. Some of them will also display anxiety. So anxiety occurs because as the disease progresses, they tend to depend very heavily on their caregivers. And when that caregiver is not inside, they get very agitated. Anxiety was seen in COVID when the caregivers had to wear the mask. And so when you came to the home of somebody with dementia, they would get very agitated because they did not know this person. You're wearing a mask, and so to them you're different. And so they will appear they'll be agitated. And some of the other behaviors, as I said, the repetition, the pacing, they will wander, and because they don't remember where they live, they will get lost, so they will wander. And there's something called sundowning that happens when the sun goes down. Many of the persons with dementia tend to wander. They tend to have this alertness. They want to go home. Even if they're at home, they want to go home, and so the wandering can occur at that time. So persons with dementia sometimes tend to wander. And then it affects your functionality. So apraxia is where somebody knows what they're to do. So you're giving them instruction. They know what you're telling them to do. They want to do it. The part of the body that needs to do it can do it, but they just cannot follow the instructions. So they hear you, but they don't understand. So everything is in order and they want to do it, but they can't because of the dementia. And then we have what is called activities of daily living, where persons are able to not able to take care of their personal hygiene. So combing their hair, brushing their teeth, taking care of their hygiene, and so on. And then you have the instrumental activities of daily living, like doing banking information, things that are more high functioning, driving, paying your bills, and so on. So that is encompassed dementia syndrome that persons with dementia will display over time. And so, as I said before, persons with dementia will come to it from different angles. Alzheimer's, that many of us know, it is noted that it starts around age 65. It's progressive, it's slow in developing, and so persons with dementia of the Alzheimer's type can live with it a long time without it showing. Then you have vascular dementia, which is the one that when you have a stroke, and that can affect your motor skills almost immediately, because once oxygen is cut off from the brain, it affects your memory. Then you have dementia with Lewy body, and Lewy body, persons with dementia with Lewy body tends to hallucinate, and they tend to drop, and they tend to fall a lot. So they can't stand it. They tend to almost resemble Parkinson type. And so they will have sleep disorders and they will have hallucinations. Then you have the mixed dementia, which will be a combination sometimes of Alzheimer's and vascular dementia. And once somebody has that, it speeds up the deterioration in the brain because it's affecting two areas. The heart is affecting your brain, and the plaques on your brain is also affecting your brain. So persons with that mixed dementia tend to display, gradually, quickly, they show the signs of deterioration, for want of a better word, quicker than somebody with Alzheimer's or vascular alone. In Jamaica, a study was done by Mona Aging and Wellness, and it found that the majority of persons in Jamaica actually suffer from vascular dementia. So for us in Jamaica, vascular dementia is a leading cause, because again, we have many persons with stroke and heart conditions. So these are some of the risk factors that the studies have told us that will increase your risk of dementia: traumatic brain injury, midlife obesity, midlife hypertension, smoking, diabetes. And diabetes, I'm told, in the literature tells us that Alzheimer's disease is considered type 3 diabetes. So that is the language that is being spoken now, that dementia is type 3 diabetes. And then, little evidence, history of depression, sleep disturbances, and high cholesterol levels, which is a hyperlipidemia. Then we have the decreased risks of dementia. Persons who study for a long time, use their brain, exercise their brain, learn a new language, doing crossword puzzles, doing something different, studying some more, even in old age. There's strong evidence of that. And I will quickly tell you about a study that was done among some nuns. And the nuns, when they died, they looked at the brains of those nuns, and they recognized that the nuns should have had dementia, but they showed no sign. So even though their brains had heavy plaques and tangles on it, they did not display any signs. So after that, when they checked the brains, they found that a lot of them should have been displaying signs of dementia. Then we have the physical activity, walking, drinking, and I'm going to put in there, drinking lots of water. Water is important. As we age, we don't remember to drink water. And when we are dehydrated as older adults, it can also affect our memories, and can be sad, and people can think that you have dementia. So, drinking water is important as we age. And we have to remind our older adults that they have to drink water. We have to encourage them, we have to remind them, we have to make sure that they do drink it. Then, though evidence of studies show that the Mediterranean diet high in, olive oils, fruits and vegetables, your coconut oil, your cold pressed coconut oils, all of those things are there evidence, some evidence that works as well. Cognitive training and social engagement. You know that once you are isolated, people who are isolated tend to have issues of sometimes with hallucination, because they see and hear things that are not there. So we have to encourage, our older adults, we have to visit our older adults and to encourage them, and so on. So these are some of the risk factors of dementia. So quickly, the ADI, Alzheimer's Disease International, tells us that every 3 seconds, someone in the world develops dementia. And the cost for dementia is over US $1.3 trillion. And it's expected to increase, it's forecasted to increase to US 2.8 trillion by 2030, less than six years from now. Some of the estimated costs and projections of dementia over time. In 2019, 55 million people was said had dementia. In 2030, less than 6 years from now, 78 million people will have dementia. And by 2050, 139 million people will have the disease. So we can say, categorically, dementia is currently the 7th leading cause of death and one of the major causes of disability and dependency among older people globally. Women, and I heard Dr. Parks mention that women are disproportionately affected by dementia. So sex is important, both directly and indirectly. Women experience higher disability-adjusted life years and mortality due to dementia, but they also provide 70% of the care work for persons living with dementia. So women are disproportionately affected by dementia. And these are some of the costs to dementia. This was from the World Alzheimer's Report 2015. Population with dementia, and this is for Latin America and the Caribbean that we pulled out. Population with dementia, 3.4 million overall. But in the Caribbean, it is estimated 321. And this figure could be understated because in the Caribbean, many people are undiagnosed. And so this figure could be more. Per capita, to look after somebody annually with dementia is US 9,000 per year. The total cost, US 23 billion worldwide, US 604 billion, but in the Caribbean, US 23 billion. And some of this is accounted for because in the Caribbean, many of us care for older adults. So we have informal caregivers, the women in our families, sometimes or boys, to a lesser extent, because their care is different from women's care. They may provide the monies and so on, but the women provide the day-to-day care. So informal care accounted for 1.5 billion, while direct medical costs account for 0.78 billion, which includes medical, drugs, and tests. And the direct costs for dementia accounted for 0.71 billion, which included social services, institutional care, and nursing homes. And that is for those persons who may put their family members in a nursing home. The cost as a percentage of GDP is 1.3%, and that is mostly informal caregivers, or families who are taking care of us for no pay. And that has policy implications, which we'll talk about. So our caregivers, there are policy implications for that as well. Then we have a direct cost as a percentage of GDP, which accounts for 0.53%, which exclude informal care costs. And so we can say that there's a narrative that population aging is a time bomb. We can see why based on some of the things that we have talked about so far. So aging is a development phenomenon. So it means that there is both positive and negative opportunities and challenges. It challenges governments because governments now have to think in terms of older population in the national development strategies, in the creation of opportunities for them, because we're living longer. You have to take notice of us. Older people are also the repository of our traditions. They provide social and cultural resources for our nations. The 2030, which is less than 6 years, I'm saying this over and over, agenda for sustainable development, and the Sustainable Development Goal says, leave no one behind. So we have to think in terms of what do we need to put in place to ensure that no one is left behind. As a social worker, as an administrator, we have to think of what are some of the pre-planning considerations. So before you jump into planning, before you jump into the decision making, there's some pre-planning consideration that I think we need to take into account. We need to find out, and this is within your country, you need to think in terms of your own countries. Is there a ministry with responsibility for older adults? And do we need a ministry? Do we need some act of parliament? Do we need legislation to establish a ministry or office on aging? Do we need to have that? Do we need to have a legislative framework to ensure that our aging population are front and centered? We also need to conduct a situational analysis. So in our countries, we need to, before we start designing an aging policy, we need evidence-based to make our decisions. So we can't do a women fancy. We know aging is happening, but how does aging look? And these are some of the questions that I'm asking. This is not exhaustive, please. We need to recognize, and when the study tells us, we're going to recognize that older adults are a heterogeneous group, and they are also not only positive beneficiaries of welfare, they are very active. We need to consider social protection measures. Old people don't become old poor without pensions. There are young people who are in low-paying jobs, who did not have a pension, who are in the informal sector, who are providing possibly care for their family members. And so for them, when they get older, there are implications for them. So we need to think in terms of policies across the life course. Yeah, so it's not just about the aging population and old people and the 80s and over. We're talking about from birth. We need to start thinking about what are those policy implications. What are the living arrangements of our older adults? Many of our older adults want to die in their own home. So we need to find out what are the living arrangements of older adults. As I said, this list is not exhaustive. What are the needs of older adults according to gender and socioeconomic status? Yeah, so our situational analysis need to help us with some of that. What is the health status of our older adults? I told you before that we're aging, and we have a Planning Institute of Jamaica and we have a Statistical Institute of Jamaica. What are the health status of the older adults in your country? Yeah, is it similar to the global standard, hypertension and diabetes? Then we need to, in our consideration, we need to look through also what are some of the good practices in the Caribbean. We need to review those and we need to adapt and adopt some of those. So we want to look first in the Caribbean. What are some of those? And you notice I never said best practices. I said what are some of the good practices that are there. And so we want to talk about when you now have your situation analysis, you have some information, you have some evidence about what is happening, we need to talk about a policy on aging. And included in that policy on aging, we need to talk about retirement. Do we still need to have people retire at 60, 65 in some cases? I remember some years ago that Barbados, I think, increased their retirement age to 67 when they saw that people were living longer and their country was, the leading in aging, in the aging population. They increased their retirement age to 67. I think they're one of the first and the only Caribbean country that has increased. But I could be wrong, but I know that Barbados 67. We need to establish guidelines to address the minimum standards of care in institutions. We're going to need institutional care for some of our older adults. The families will not be able to care for persons with dementia as they progress. Yeah, because it's a progressive disease. At some point, the families will not be able to do that. So we need to have some policies in terms of minimum care, minimum standards of care. We need to think in terms of protocols in times of emergency. And COVID has shown us that. How do we deal with our older adults in times of crisis? How do we deal with our older adults in terms of elder abuse? What are the protocols in place? Just like how we have a children's advocate, just like how we have an organization that focuses on children, just like how we have an Ananda Alert, do we need to have an advocate for older adults to deal with the issues as they arise? We need to also take into account poverty among older adults. Many of our older adults were young poor, they're going to be old poor. So we need to talk about poverty among the different socioeconomic levels in our country. We need to start thinking about that. Those are policy things that we need to start thinking about. We need to adopt age-friendly approaches across hospitals and healthcare clinics. So we need to start thinking about that. I'll talk a little bit more about that as I tease out some of these a little bit more. And those are food for thought. We need a focal point on aging, staffed with social workers. Jamaica has a National Council for Senior Citizens, but possibly their remit could be extended to include more, coordination. We may need a legislation to say that they have authority to make certain decisions, that they're under a particular ministry. So that is just food for thought. So we need legislations, we need policies, we need programs geared towards promoting healthy aging, reducing non-communicable diseases, and initiatives that can keep older people healthy longer. We need to improve chronic disease management, and we need to improve dementia care.
Sandra,
sorry.
Just to tell you, boy, this is so fascinating. So, but we want to allow some time for discussion.
Yeah, man, I'm wrapping up. And these are just pictures that I'm coming to know.
All right, no problem.
Yeah. So these are just all right. So our focal point, National Council for Senior Citizens. These are some of the activities that they do. So they establish clubs, older adults club. They do training and so on. These are some of the thoughts that I talked about when you talk about integrated social support services. And you'll get the slides. So some of the things that we're thinking about, pension, and so we need to start thinking about that. social workers as critical assets. We need to think about integrated health model for older adults, staff with geriatric, persons trained in gerontology, people to make decision making. We need to include people decision making on the end of life issues. Jamaica does not. I don't know how many countries have a life policy. What do I want to a living will? Oh, sorry, many countries and Jamaica included, we do not have a living will. So how do we know that our older adults want? Do we know how they want to live with dignity? So we need to, and the affordable drugs, as I said, I'm using Jamaica. We have JADEP, Jamaica Drug for the Elderly, because we recognize that every older adult, 60 and over, has at least one chronic disease. Then we need to develop a dementia care plan. And included in that dementia care plan is not only for the caregivers, but we have persons who are working in the formal healthcare sector that may have mild cognitive impairment. So agencies and organizations need to start thinking about that. Yeah, and we also want to think about our informal caregivers, persons who are caring for our older adults who are not in the formal sector. And so we wanted to, in the end, we want a dementia-friendly society where early diagnosis and so on is done. Then we want to talk about policies about eating right. We want our governments to ensure that vegetables, fruits, and vegetables are affordable. A healthy heart is a healthy brain. So we want from childhood to adulthood, affordable food. Ministry of Health again had launched the Jamaica Moves to reduce non-communicable disease by 25% by the year 2025, which is next year. And so, just quickly, there are opportunities, and I call this the silver economy. I don't think that's what persons in the literature meant, but I'm saying there are opportunities for persons to create employment for themselves because older adults demand different kinds of services. So we can create opportunities for young people as well. And these are some of the ideas. And these are my pictures. So the state has done something. So our National Council for Senior Citizens planned a Caribbean cruise. I thought that was so wonderful. Then our national libraries across the island, they have set up seniors coffee and conversation for persons 60 and over. So these are some of the things that the state is doing. These are some of the opportunities that our people have created. A colleague of mine, well, a student of mine, she started the location therapy where the person with dementia, she will keep the person with dementia so that the caregiver can get respite care. And another colleague of mine, Donna Singh, provides support for the caregivers if you need to go to market to buy things. So there are opportunities for the job creation. And so I will not read my long speech about the balance between, we have to make a decision, governments have to make a decision, and sometimes it is not expedient. They want to think in terms of childcare and prenatal care as opposed to aging care. So sometimes the government is balancing. Do I look after the older people or younger people? Do I look to, how do I spread my resources? But ultimately, as we plan for our aging population, we're also planning for our own future. And many of our members of parliament are older people, they're over 60. And I suspect you may have the same. And I will just quickly share some of the work that I've been doing. So I've written some articles in the newspaper. And of course, our Caribbean Journal of Social Work, everywhere I go, I advertise that. It's online, and so you need to read some of the articles. I've written one about the complexity of dementia care in that article. And so I thank you, and if there are any questions that you want to ask.
No, Sandra, thank you so very much. Thank you so much. I think, so Stephen has his hand up, and while I allow Stephen to unmute, but I actually think the Barbados pension age actually went up one more time, I think it's
okay. Okay.
Pension can tell us in the chat. But Stephen, you are unmuted. Wait, Stephen, you want to unmute?
Good morning.
Hi, yes, we're hearing you. Go ahead, Stephen.
Good morning, Ms. Parks, and good morning, Ms. Latibeaudiere. Thank you so much for that presentation. This is an area that is close to me for intellectual interest, but I'm seeing some down the road, some implications that it can have for national development. I'm at the Ministry of National Security.
Okay.
And I'm sort of seeing down the road where it could have some issues for security as well. My question to you will be preceded by a comment. My question has to do with the birth gap in Jamaica. But my comment really is that you mentioned one of the drivers or factors being childlessness or the low birth rate in Jamaica, right? And you mentioned that 1 in 5 Jamaican women will not bear children in the not too distant future, or I guess I don't know if that's the reality, no, but not long from now, only 1 out of 5 women will not have children in their lifetime in Jamaica. My question is, well, it appears that we have to plan to make our population younger. A lot of the strategies and the responses you mentioned cost money, and government source money from taxation, right? Some kind of family planning and migration on the other side of the coin is needed to boost our younger tax-paying section of the population. The question is, what has your research shown you about the use of and attitudes towards hormonal birth control, and how big of a factor is that in childlessness and the birth gap that contributes so much to the aging of our population? Thank you.
I have not, the birth rates and stuff, I have not been a part of my study, but I want to say that informally though, a lot of our young women, and we're now at where we know alpha generation, many of those persons have actually decided that they don't want to have children. So we have quite a number of persons informally who have said that they will not have children. They want a career. So in terms of your question, I will not hazard a guess to answer that. The hormonal, probably somebody else can. But I know that we have found that quite a number of women have decided that they do not want to have children. But I'm not going to talk about the hormonal. But thank you for your question. It's something that I guess I need to think through as well.
Yeah.
But national security, you're right about national security. So we need to talk about security, not only pension security or income security. We need to talk about security, physical security. We have quite a number of elder persons being abused. So that is something that our Minister of National Security also needs to think about. But thank you for your question. I don't know if Dr. Parks, your team.
Yeah, we're taking note of the, like I said, this is such a multidimensional issue. It really, really is. But thank you, Stephen. I'm just looking in the chat, and there are quite a number of comments and issues being raised. So Erica has raised the issue of the consideration need to be given for the upskilling of persons with responsibility for caring for the elderly, and the monitoring of nursing homes, and ensuring that these nursing homes have the necessary skill set to take care of the elderly, especially persons suffering with diseases such as dementia. I don't know if you can speak any further on that, Sandra.
All right. The thing about it is that, and the sociologists will tell us, we're going to need some people to be garbage collectors. We're going to need people who are going to be caregivers in order to ensure that persons in the economy can work. What we need to think about is how can we ensure that the minimum wage is a livable minimum wage, that persons can in fact still have a family, still enjoy social outlets. Because as it is now, our caregivers, our helpers, our gardeners, our garbage collectors, and I'm using those even our people who work in the factories, factory workers get about 13,000 a week. Is it that we're saying to them that they should not have families? Is it that we're saying to them that 13,000 a week is really bus fare for the week, and then if they have families, that is going to be another issue. We need to think about how can we reasonably, because even if you upscale everybody and everybody become lawyer, doctor, Indian chief, we may not be able to function at our jobs because we still need the support. We need the care support. If we're having children, yeah, the ones who are having children, they need caregivers for those children for them to be able to go back to work. And so it's a catch-22. How do we, and I think Stephen said it, it takes money. So we have to sit down and we have to think through how do we do this, because it is a real issue. It is a grave issue, because as we found in the 2012 study, that a lot of people do not have a pension. And so what do? When your helper gets a stroke and can't work anymore, she's not earn enough to be an NIS. We have to think in terms of what are some of the non-contributory pensions that we need to have. So it's a lot of, it's a multifaceted, so it needs an integrated discussion around issues like that. And as Stephen also said, migration. We haven't even talked about migration. Do you know that what some countries do? If you migrate, you have to send back your tax. Do we need to do some of that? I don't know how that would work, but do we ensure that to go abroad to work, that the tax come back? We see it in the Europeans when they come and they do consultants and they work here. Some of the money goes back to their country. If you're coming back to retire, we need to start thinking about how do we ensure that when you come back to retire, most persons come back to retire in Jamaica. We probably need to do a tax or something to ensure that when they do come back, the persons who are here, the resources are not stretched that they can't accommodate everybody. So it's a multifaceted discussion that we need to have. It's not a one discussion and a one solution. It is a whole lot of stuff that we have to take into account. But it's not, all is not lost. All is not lost.
All is not lost indeed. And Cleveland makes a point here that, that the aging population should not only be seen as a burden, but should also be seen as a really important resource. Given that they have a lot of experience, they have usually a very strong education base. And so, how do we tap into their continued contributions that they're able to make? Not necessarily, he wasn't really asking the question per se. Something else to consider. Another question came up. Robertine asked, at what age will be considered as citizens? Really, I mean, the way the question is worded kind of strangely, but I think really she's asking, what really is a magic number to say, yeah, this should be the age for retirement? This is the age when you truly consider somebody a senior citizen, because people are living longer. Pension ages have been increasing in many jurisdictions. But what is that magic age? I mean, last year, Barbados said, no, we're making the magic age for us is 68, What is that magic age? I do not know that there's a number, but here's what I do know. For me personally, while I will not necessarily be in a full-time job, I believe I should plan to work as long as possible. I think that's the truth. I think people need to plan to think about how can they, and that how your earning income can look very different. It doesn't have to be the job traditional solution as we know it. It can be you develop, you become a part-time entrepreneur, you find ways to make passive income, whatever that looks like. But I think we have to start to plan. And so don't think, oh, there's an age, a 65 or 60, but I think you just think of it as different phases. Let me continue to check. So there's so many
facets to this discussion.
Comments, and so many comments in the chat. Let me just check here. Sonia is asking, what about training for the elderly in life skills and other skills to keep them engaged? That's something to think about. Faye has made some points here about Barbados. So, the situation in Barbados, one of the things they're looking at is very carefully managed immigration, their population. They have implemented a community elder care program financed by the government to assist the elderly. And that is in addition to the already functioning welfare program and National Assistance Board that assists shut-in citizens. All right. All right, so I think Frankie has his hand up. So Frankie, go right ahead.
Good morning, Lloyd. Good morning, everyone, and commendations to you and our colleague from UWI for a very, very important, very useful, insightful webinar. But I wanted to take the opportunity, since I was here as one of the seniors, a senior professional, let's say, as a senior professional, to just quickly make the point that for those of you who are the younger professionals, especially here, permanent secretaries and deputy permanent secretaries or directors and equivalents or heads of state agencies and similar public sector entities across the region gathered here this morning. Think about something. We very often talk about integrated policy planning. CARICAD's concern over the years is that we seem to drop the ball when it comes to integrated policy implementation. In other words, we structure our public sector into various ministries, departments, and agencies, and the integration. We talk about aging being a multidimensional, multifaceted issue that is going to have implications across the board. So therefore, even if you set up a ministry with responsibility for aging, a responsibility for dealing with older persons, that entity by itself is going to need tremendous support from other entities.
Yeah.
So CARICAD has advanced the case for a while now that our committees of permanent secretaries need to be functioning more cohesively on the basis of policy planning that is integrated, but with the focus on implementation that together as a team of permanent secretaries that you account for. And we would really love to see permanent secretaries embrace the principle. We have an actual guideline that we've developed and we've circulated, and that's available. You can contact Lloyd if you'd like to get a copy of it, if you haven't had a copy of it, because we do really believe that going forward, that integrated, coordinated implementation, not my word, I have nothing against policy planning. It's critical, but we drop the ball too much in this region on integrated implementations. I would love to see, like I said, as a senior professional, that in the years that I have left, that we improve how we implement across the board together and really bring these things to the fore and account for them together so that we don't just leave it to a single ministry and say, well, okay, because Ministry X didn't do this, this didn't happen or that didn't happen, realizing that Ministry X could never have done it all in the first place. And I'd very quickly like to suggest that, you know, we take a close look at the Barbados model for a number of things, but in particular the social partnerships, the integration of thinking between government, public sector, and private sector that has been developed into an entire framework in Barbados with clauses and conditions and agreements and principles and issues, because again, this is not just going to be about government for solutions. It has to be public sector, private sector, non-state sector as well. So going forward, I would like us to rethink how we implement work in the public sector and how we partner outside of the public sector. Thank you very much for an excellent couple of hours, or just under a couple of hours. A lot to think about, but more particularly for you younger ones, a lot to do. Thank you.
Yeah. A lot to do. Thank you so much, Frankie. So before I let
Dr. Parks, could I just say that I take the gentleman's point. It's relevant.
Absolutely relevant.
As social workers, that's how we operate. We do what is called case management, which is we work with other entities. And I hear you. We have a challenge in the. I'm going to speak for Jamaica in terms of working with others. We don't play well with others. We are very we want to say that our ministry did this, and so when we do it as a team, you know, who gets the limelight, and that's part of our challenge. Why we're having so much issue with getting so many things done? Because if we work together, it's low cost, no cost, you know. Because you have a mandate in your ministry. I have a mandate. you are good at doing one thing. Let us lean on you. So we talk about using the best resources, because you have those skills. We don't need to reinvent the wheel, but we're going to now create another agency or department to deal with something that we could partner with another agency. But it is something that, you're right, it's something that we really need to work on as I said, in Jamaica. I'm not going to say the Caribbean, but in Jamaica, the fact that we don't play well with others.
No, thank you. No, we are out of time. But can I indulge everybody? Maybe no more than 10 minutes. You can go a little bit longer, because I see two hands, and I just want to allow these persons just to share what they have to share. Jennifer, then Lori, and then I'll do some final words from Sandra, and then we'll wrap up. So Jennifer, let me have your question or comment here.
Yes. Good morning, all. Sandra, thank you for a wonderful presentation.
Thank you.
I just to let you know that I feel your pain, and because when I was doing my research, because by the way, I'm a gerontologist, and policy is the area, but aging was my track. And when I was doing my dissertation, Dr. Denise Eldmeyer Scherer, she was my guru. Because a lot of work has been done in Jamaica, so you need to understand, you need to know that she has done a lot of work. However, the gentleman that spoke just before me, he kind of made the segue for me to say what I'm saying, because I was the one that established the Division of Aging in Trinidad and Tobago in the Ministry of Social Development.
Okay.
And just as I had identified in my thesis that what would have been the problem statement or the problem issue would be the style of governance that could stymie the policy. And true to form, it's exactly that happened. So even though my tenure was from 2003 to 2018, 15 years, the entire staff, including myself, were contract workers. And what comes with contract work? All the work that is done becomes tenuous. So none of the persons who have been there over the 15 years is in the department. I heard the department now has 2 people. There's no head, and this is not bashing anybody, because, and one of the critical points we have to understand too, is that when we speak about the low childbirths, these are millennials and Gen Zs talking, and we have to also factor in that in the labor market, they are now, because of contract work, which is not age-based, but skills-based, there are 5 generations working in the workplace.
Yeah.
And we need the intelligence from all, but at the same time, the Gen Zs and millennials have to understand, and they are not tied to territory. They are nomadic. So if they see things that they want to do in Botswana or whatever, they're gone.
Yeah.
So that whole question, so we have to look at ageism, not just as discrimination on the elderly, but also we have to look at the movement of the young people, because I'm now looking at aging as a life force perspective. We have to look at the whole schematic and understand that migration now, which is a factor that has caused aging a population, we have to see migration now as a critical component in exacerbating, because that's where our potential caregivers are going to come from. And St. Lucia recently put out to the population that they need people who are between 18 to 25 to be impregnated. They put it out there because they are in a minus. And so are we. We are 1.67 negative growth rate. So already, and I'll end with this, aging is now an economic issue, because 4% of our GDP is pension, and our public service is 90,000, and the established staff are in a non-contributory pension. So they are entitled to the pension, and they can leave after 33 and 30 years and have pension for life. And many are going to be living longer than in the post-retirement years and the years they worked.
Yeah.
So it's a crunch. And we're also looking to increase the retirement age in the NIS, in the national insurance. It can't stay at 65, it has to go up. And what happens with the young people when they see that? Because they look at the older ones as geezers, you're occupying my space. So it's a catch-22, just as you said. All right, so you have me, and you could always get my contact because I've done this and I'm looking at you with the exuberance and wish you well. But I have a lot of the information already that you could share with you.
Thank
Glad.
you so much. Thank you.
Okay,
I
Fantastic.
will be in touch. I will be in touch.
Fantastic. Now, Lori Ray, you had your hand up. Do you want to chime in here before Sandra?
Yes. Good morning, everyone. Sandra, an excellent thought-provoking presentation. These areas are always thought-provoking when I relay them back to the statistics. And I'm coming from that background, but I'll also swing over to the economics. I think a lot of what Frankie Michaels said, if it was him, I think it was him who was speaking.
Yes, yes.
We have to be very careful as a country that we don't continue to spin top in mud. We have departments, we have ministries, yes, we have tripartite government, private sector, public sector must work together. But I think there's also a need for departments within government and ministries and departments to work together. You always find this siloic kind of behavior that exists, not realizing that everybody comes to the table with a skill that they could lend to the problem. Always pull your best in to deal with their area so that the whole could be better, discussed.
Yeah.
But what we find is that the social workers, and not punning on them, but they would want to deal with stats. That's not your area. Tell us what you need to get what you need done, or we could help you get what you need done. Every year when we do the census, every 10 years, we do these publications, we put them out there, and people don't realize the implications of the population changes and the demography and how they will impact the economy going forward. It's only when the actuary is ready that we run and we say, what's the population looking like? But we need, I think, us as statisticians as well, try to explain to persons the implications of the data that we put out there. 10 years down the road, if this trend continues, what is going to happen if you don't do anything? But 10 years down the road, given the data that we have and the policies that we put in place, this is what could happen. I didn't see in the presentation anything about the ICT and the policies, these things where the banks are moving away to more online stuff. How do we pull the aging along? Yes, the young people see this as something second language, but how do we pull the aging along in that area? Sometimes it seems as if we just cutting them off, sink or swim. And then I wanted to add something else, Sandra. What about the lifestyle policies before we get to the aging? What is it in terms of health wise that we have put in place so that the dementia and those things don't creep up on you and persons could live a longer life going forward, a longer productive life going forward? But once again, thanks very much. And it is really interesting. I know you will share the slides, but can we also have the recording? Well,
We share both. We share both.
Thanks very much. I look forward to some additional discussion on this.
Thank you so much. Thank you.
Sandra, we have to give you the last word.
My last word, and it's just one line. Dementia care is very important to me. And the caregivers of persons, so persons living with the disease and persons caring for them. That actually is my my focus, and I'm doing quite a bit of work in that area. So yeah, so that really is my area. So probably another time we can talk a little bit more about dementia and dementia care.
All right. No, Sandra, you see, we agreed to stay on after the time because no, this is really such an important topic. You have given us so much food for thought. We really hope we can have you again and we can continue the discussion. Want to say also thanks to the attendees. And if you see in the chat is has been lit up with people putting links to other resources, people sharing what are some of the initiatives in this area that's happening in their particular Caribbean country. So let's take note of that, because we do not have to reinvent the wheel. We can certainly learn from each other. And so as we close out the webinar, I just want to share, one, we always want your feedback. For us, feedback is a gift. And so our virtual producer will put a link in the chat momentarily with the webinar evaluation. So asking you to just quickly click on that link once it's posted and to just give us your feedback, including any other topics that you would want us to delve in future webinars. And so in terms of, sorry, I thought there was another slide, but just while you're doing that, I also want to let you know that the call for applications is out for our mid-level leadership development program. And there are quite a few persons in the webinar here who have done this program. It's one of our flagship programs, and this will be running virtually between September and December of this year. So if you want to learn more about that program, please do contact us. Visit our website at caricad.net or email us at info@caricad.net. And the good thing about our program, in addition to it really building capacity for mid-level leaders, it also, we will be ensuring that from this training, you will get globally recognized, certified continuous professional development unit points. All right, so these are unit points that you can use to show any employer around the world, including your current, to show that you have you know, the level that you're at, the amount of professional development unit points you have, and in the areas that are covered. So, ask you to again fill out our survey. And with that, once again, thanks, Sandra. And thank you all for being here. And I wish for you all a good rest of the day, a fabulous work week, and look out for our next webinar advertisement. Thank you all so very much.